My name is Adam Dhedhi, and I'm a gastroenterologist at HCA Florida, Palm Beach Gastroenterology. The types of patients that I see are any patients that have a complaint related to their digestive system, whether it is swallowing problems or difficulties going to the bathroom. We also see patients with pancreatic issues and liver issues. We treat constipation and diarrhea quite a bit. We can do several evaluations, including a colonoscopy, to help determine what the cause of those conditions are. We offer a variety of treatments, both endoscopic treatments and medications to treat those conditions. So my communication style with my patients is based on educating them first and foremost, because I believe that if they understand what's going on with them, they'll have a better idea of why we're doing what we're doing. So I like to sit down with them and explain what's going on. I use a lot of the diagrams we have in the office to explain what part of the GI tract that we're treating, why we're taking a certain approach, or why a certain medication would be beneficial to them. As far as lifestyle modifications go for a lot of the treatment options we offer, for the patients I see, I like to make that priority number one. If people can modify their behaviors and feel better, that is much better in my opinion than starting them on any medication.